Hi, I'm Kayla Murphy here with Pam Peitz, a nurse and program manager of cardiac rehab and heart failure programs at Meritus Medical Center. Today we're talking about heart disease in women. Hi Pam, how are you?
Hi Kayla, thank you for having me.
Oh, thank you so much for coming out to talk to us today. So when a lot of people think about heart disease, they think of men. I know I see the guy holding the baby aspirin pill in the commercial, but it really is a disease that affects women.
It's true. After the age of 50, about half of women will die of heart disease, which is more than all cancers combined. But there's two reasons why it's thought of as a man's disease. First of all, men tend to have the more typical symptoms that we think of with a heart attack, crushing chest pain or chest heaviness. Women's symptoms tend to be more atypical. And for many, many years, most of the research on heart disease was done on men. So we kept hearing about all these studies involving men. Now, fortunately, we do have a lot of studies that have involved women in heart disease.
What do women know? What's different about men and women and heart disease?
For one thing, women tend to get heart disease at a later age, usually over the age of 65. The reason women get it later is because estrogen is protective against heart disease. So it's generally after menopause where women lose that protection. Estrogen actually helps to balance the good cholesterol with the bad cholesterol. It also helps the skeletal muscles so that they're less likely to get damage to the inside of the coronary arteries.
What are the biggest risk factors for women and heart disease?
The risk factors for women are the same as they are for men, and of course there's some risk factors that we cannot control. Heredity being the biggest one. Diabetes. People who have diabetes have a huge risk of having heart disease. And race. In the United States, African Americans have the highest incidence of heart disease. So what we really need to focus on are the risk factors we can change, which of course smoking would be number one, being overweight, sedentary lifestyle, people need to get out and exercise, follow a healthy diet, which would be low in fat, high in fruits and vegetables and fiber, and last of all, making sure that both blood pressure and cholesterol are well controlled with medication if they're elevated.
You said that after menopause, women are more susceptible to heart disease. What can women do if they are postmenopausal and don't want?
And that's $1 million question. And unfortunately, the answer we have these days is a 10-cent answer, but the problem is, because we lose that estrogen after the age of 50, our heart disease risk goes up. For a long time we thought the answer was hormone replacement therapy, and that is not the answer. In fact, when they did very large trials of over 100,000 women, they found in some of those trials that the risk of heart disease and breast cancer went up when women were on hormone replacement therapy.
Oh, wow.
So really what women need to do after the age of 50 is focus on all those risk factors we talked about: smoking, maintaining their weight, exercising, eating a healthy diet, and making sure their blood pressure is well controlled.
I understand you guys have an event coming up. Do you want to talk about that?
We do. I'm very excited about it. Several years ago, the American Heart Association and the National Heart, Lung, and Blood Institute decided to set aside a day called Wear Red Day, also known as Go Red for Women. And the purpose of that day was to increase the awareness of heart disease in women. And that day is always in February. And so at Meritus Medical Center, we're having a dinner on February the 16th. We're calling it the Wear Red Dinner, and the theme is an evening of wine and chocolate.
Wine and chocolate. Why did you choose that? Well,
we're going to talk about the health benefits of wine. Dr. Falahi, one of the cardiologists at Hagerstown Heart, is going to discuss the health benefits of wine. Of course, it's going to be a very balanced talk because there are risks associated with drinking alcohol as well. And then we have a guest from the Hershey Corporation, Deborah Miller. She's a chemist who's going to be talking about the health benefits of chocolate.
Well, I think I'll have to come and find out why wine and chocolate are good for me.
We're going to have a sit-down dinner, a heart-healthy dinner. We're going to have a marketplace ahead of time with various vendors that the folks can visit.
Okay, so when is that happening?
It's on February 16th. It's in the evening, and it'll be held at Robinwood Medical Center in the big conference room, room 142. Okay. And folks who would like to attend do need to register for that in advance.
Okay, how do I register?
By calling the registration line at the hospital, which is 888-803-1518.
Okay, great. Is there anything else you'd like to share with our viewers before we say goodbye?
Well, we're really looking forward to having a great turnout on Wear Red Day, and we hope that all the people that come will wear red.
Great. Well, thanks so much for talking to us, Pam. I'm glad that we got the news out about this event. It sounds like it's going to be a lot of fun.
I'm looking forward to it.